Good morning, and thank you for joining us today for Humboldt County's COVID-19 virtual news conference. My name is Mariah Miracle. I'm a public information officer in the Humboldt County Joint Information Center, and I'll be moderating today. Let's start by introducing our participants. 4th District Supervisor Virginia Bass, Humboldt County Health Officer Dr. Ian Hoffman, Family Nurse Practitioner and Humboldt County Vaccine Task Force member Lindsey Mendez, Humboldt County Economic Development Director Scott Adair, and Emergency Services Manager and Emergency Operations Center Director, Ryan Derby. So each participant will now give a brief update on what they've been working on in relation to the COVID-19 pandemic before taking questions. Let's start with Family Nurse Practitioner and Vaccine Task Force member, Lindsey Mendez. Lindsey.
Hello, today I'm going to be coming to talk about allocations of the COVID-19 vaccine and also my turn, which is going to be explained first. So my turn has been a transition that we've been going through with the state of California so that we can have a way to register anyone who's eligible in the state of California for vaccine. With that said, though, we've had some bumps in the road and we've had some changes with geofencing, and that's what my turn calls the ability to open or close specific geographic regions so that it limits who can get to the vaccine. For a little while, it was close to a 50-mile radius, but it's now been open to a 200-mile radius, which is extremely helpful for Humboldt County and other areas. So this should be easier for people all around the county to get a vaccine appointment right now. And we would encourage everybody to keep on going on to my turn to register and checking on the status of their vaccine, since we have many appointments available right now in Humboldt County. With that said, with the side of allocation, this goes hand in hand. When we talk about how we allocate the COVID-19 vaccine, it comes from initially a state allocation and then it goes into counties. But now the TPA, which is Blue Shield, is going to be helping the state with doing those allocations and positioning of the orders of the vaccine. When we look at how that happens, my team, who does advisory and also allocations, we have a few people from the task force who look at the numbers weekly of who needs vaccine in the area and how much vaccine we need in general, and what kind of clinics we'll be setting up for that week of allocation. So when we say that we have different numbers per week of how much vaccine we get, or we say that we have all this vaccine in our county for this 1 week, or maybe we're running out of vaccine this week, it's because of the way of the schedule. So we would encourage every person who is eligible to get the vaccine right now to go on to my turn to try to get their appointment, because we would like to get as many vaccine out every week as humanly possible and empty our freezers. So that is the status of both my turn and appointments and allocations. Obviously, we are having some a little bit of a drawback with Janssen right now with our allocations, as we are not able to use it at present, but Dr. Hoffman will be talking about that a little later. So, thank you.
Thank you, Lindsey. Ryan, can you share an update about the Emergency Operations Center?
Yes, good morning. So I'm going to touch on just a couple things, just a brief overview of what the EOC has been doing and some future plans for transitions in our response. So throughout the pandemic, and more specifically now, the EOC has been focused on the planning and logistical components of the response, supporting public health with material acquisition for the vaccine clinics, for testing, ensuring state and federal compliance with response guidelines, and also providing the management structure for the public information, the financial component, and the planning piece of our response. So our goal primarily is to provide the things and the people to make public health successful with their vaccine efforts and their testing efforts. And with that being said, we're actively working on some plans to transition that management over to public health, essentially demobilizing the Emergency Operations Center and transitioning it back to a Department Operations Center at the end of June. and still providing some of that logistical support, but that'll allow us to focus on the upcoming fire season and other emergencies that could be coming up in the future. Right now, the biggest push is vaccine outreach. I think it's been said over and over again that we have thousands of doses that we need to get out into the community. So our public information section, or our Joint Information Center, is actively working on that vaccine outreach, and we're exploring different ways that we can make that message loud and clear. And we're hopeful that with the geofencing issue being worked out with my turn, that we'll start seeing an uptick in that vaccination rate. But that concludes my brief report.
Thank you, Ryan. Supervisor Bass, can you share an update?
Yeah, thank you very much for having me this morning. I think you can all imagine we've been getting a lot of questions about when county offices are going to open completely. And we know that's a really important step on our road to recovery. And to that end, I do want to share with all of you that in May, we will be having a discussion at one of our Board of Supervisors meetings, as yet to be determined which one, regarding the concept of coming back to work on June 15th. Employees, Board of Supervisors, everyone we can possibly get here. It's really important for the community to see us moving forward. And this date also coincides with the date of reopening California. So it'll be an interesting conversation and a lot of work to do. And of course, during the past year, we were introduced to Zoom. In the beginning, it was all strange and confusing, but now it's become commonplace. And quite frankly, it's one of the most important ways of doing business these days, even though it is still strange and confusing sometimes. But we realized that over the experiences of the last year, that employees can be extremely productive when they work away from work. So it's given us an opportunity to think about teleworking in the future. So we'll also be we'll be bringing forward an ad hoc committee to have a conversation about telework for our employees. And we think it's going to be a wonderful fit. It doesn't mesh for every department we have or every job, but it certainly has a lot of usage that we can do a lot more with that. I mean, just like what we're doing right now. But in the meantime, please know that all county departments are open and servicing to some degree. We can't wait till they all reopen completely. In the meantime, if you have questions about services and you want to know what's available, just go to our HumboldtGov.org site, and there's a tab called Government Services. And that should give you a really good idea of what is open and what isn't. And hopefully we won't have to worry about that, and we'll just be all open soon. So that's basically, I believe, what I am going to share with you today.
Thank you, Supervisor Bass. Scott, can you please give an update?
Yeah, I would be happy to. My name is Scott Adair, and I'm the Director of Economic Development for the County of Humboldt. Our office manages and administers a number of programs to help the business community through this pandemic. As it's widely known, this is a global economic crisis as well as a public health crisis. Our office recently concluded its SBRR program, which is the Small Business Restart and Recovery Program. And as of to date, over $3.4 million has been put back into the hands of nearly 700 businesses to provide aid and assistance and COVID relief for the business community. It's important to share that that was not just an unincorporated county effort. That includes businesses in all of the municipalities as well who were part of that program. Our office also continues to manage and administer the new reopening plan process. Until recently, businesses were required to submit their actual written reopening plans to the county, and then those plans were reviewed, and those businesses were given certification to reopen. Once those reopening plans were successfully reviewed and considered as sufficient or passed the approval process, now businesses are asked simply to have a plan and comply with the local health orders and restrictions from our public health officer and from our governor's office. and to watch an instructional educational video, and then to take a quiz after that video to demonstrate that they know and have a knowledge and understanding of what it is that they are required to do. Once they're able to demonstrate that they have that knowledge and they pass that quiz, they get a certification from our office. This has cut the time down. What we've been told talking with businesses, the new process is relatively 1/4 of the time that was spent on the old process. So we've made the process more efficient, and we've improved it for businesses so that they can focus on their main operation, which is to create revenue for their employees and their stakeholders. Our office also concluded an outreach survey. Our office reached out to over 30 businesses throughout the business community, representing 26 different industries. And those industries were diverse. From credit unions to coffee shops to bookstores to a dairy farm, to ask how they've been impacted by the county's policies and restrictions on businesses. And we received that feedback and identified some top or shared priorities and concerns, and shared those concerns with our supervisors and other county administration so that they have that information and they can use that to help inform and guide some of the decisions that they are making with regards to any policies that could have an impact on the business community. And then finally, our office continues to aggregate and collect data on programs and grants and loans and other assistance opportunities to provide our business community with relief and with support. And we have all of that information housed online on our website, and we continue to engage with the business community in different industry conversations and stakeholder group discussions to collect input from the community and to share that data with them.
Thank you, Scott. Dr. Hoffman, can you share an update?
Thank you, Mariah. Thanks everyone for being here today. Yeah, I'll start with a brief update just on the epidemiology. Talked about this at the Board of Supervisors yesterday. You know, we're definitely at a new place in the pandemic with large portions of Humboldt County being vaccinated. We're now around 50% of all of residents who are eligible, who are 16 and over, now have at least one vaccine, which is fantastic. Still a long ways to go, but we're definitely have made incredible strides. We have 80% of our 65 plus population with at least one shot. So we're really in a different place. However, we're still seeing cases. The case counts are rising again. This is something that we've been expecting. We've seen it in other places. As we reopen, we're going to see more cases. So our case counts are still not below where they were since before November. And you know, we'll hope that we can turn this tide, but they are increasing over the past week. Just, you know, want to remind everyone that we're not out of this yet. You know, please continue to follow all of the state health officer guidance for gatherings and the blueprint around businesses and what can be open. The other thing, just to update folks on, a lot of questions right now about Johnson & Johnson and what's going on with it. What we know right now is that on Friday, the CDC is going to meet again to review the data and see what's happened in the past week since they last met, and give some recommendations. So we'll be anticipating some form of guidance that'll come out after that meeting on Friday. So, and happy to answer questions about that and anything else as we go on to the next stage of this. Thank you.
Thank you all very much. So now we'll move on to questions from reporters. Please try to limit your conversation to a single topic. And if other reporters have follow-up questions about that topic, you can raise your hand and we'll take those afterward. And a reminder that we have a hard end time of 10:30 this morning. So we'll start with Lost Coast Outpost, Ryan Burns.
Hi, thanks. So you've mentioned that there are thousands of vaccine doses available this week. And over the weekend, the Chronicle had a story about the county sending 1,000 Pfizer doses to San Francisco because the county had overestimated local demand. But we know that there are still, tens of thousands of locals who haven't gotten vaccinated. So I'm curious if you have any theories about why demand has dropped off and what the plans are for reaching the remaining population.
Yeah, thanks, Ryan. Ian, do you want to speak to that?
Yeah, I think what we're seeing is what has been seen in a lot of places across the state, that we get to a certain point and demand drops off pretty suddenly. The Chronicle had another story today about Napa County and their experience with this. And it's something that the state health officers have been talking about for some of them 3 or 4 weeks now, have been experiencing this. So in some ways we're a little bit delayed on this. We're seeing it later than many other counties. I think there could be a number of reasons. Lindsey mentioned, the change to my turn is certainly one of them. I think we went from a scarcity mentality to an overabundance mentality pretty rapidly. So hopefully there are still a lot of folks out there who want appointments, and now with this information getting out there that there are lots of appointments available, they'll start looking for those appointments and be able to match up to them. So my turn's a great place to go. We fixed that geofencing thing. I tested it this morning. If you're in Garberville and you put Garberville in, it's actually now going to show you every clinic from Arcata to Reading. So that should be helpful for people. And just getting the word out that the vaccine is no longer scarce. We have enough for everyone. So there's no more waiting your turn. It's now everyone's turn, and get out there and take it.
Thank you.
Can I ask a quick follow-up?
Yes, my apologies.
Okay, thanks. I'm curious. I see a lot of comments online from folks who are skeptical of the vaccine. Do you have any sense of what portion of the local population is vaccine hesitant, and what are the public health implications if we do have a significant percentage of the local population that just declines to get the vaccine?
Dr. Hoffman, thank you.
Yeah, certainly it's something that's being talked about a lot. It's hard to know if that's what we're meeting up against, or if it's really this change in technology to my turn, the change in mentality from a scarcity mentality to an abundance mentality. Certainly as a physician, I understand that there are patients who don't want vaccine, or are hesitant, or have questions. My approach as a physician is that we try to recognize where they're coming from and see if we can meet somewhere. So I think there are going to be folks who are going to need more outreach, to get into the clinics. But I don't think that's what we're seeing right now. I think what we're seeing right now is a switch in mentality, a change in technology, a change in the way that we're getting the vaccine out, and and getting it out in different ways. That Lindsey could talk to some of the other ways we're going to be working to get mobile clinics going out to rural areas, to get the homebound, to pick up folks who have a difficult time traveling 50, 60, 70 miles to a mass vaccination site, or just that they maybe that's not the best place for them and their doctor isn't giving the vaccine. So there's a lot of barriers still that we need to break down those barriers. And that's where the point we're starting to get to. But I still think there's a lot of people out there who would benefit from getting vaccinated in a mass vaccination center. So we're hopeful that we can continue to get those folks in while we have the mass vac centers going in the next weeks.
Great, thanks.
Lindsey, do you want to go ahead and share some of those details?
Sure. Hi guys again, thank you for your time. The other portion of what I've been working on right now for the public health branch is having a task force that is dedicated to doing mobile outreach. In fact, it's going to be called a mobile medical unit that's dedicated to vaccine. We have partners in this community who also do mobile outreach. So the coordination effort is a little bit more complex than just public health going out alone. For example, Open Door is doing mobile health outreach and United Indian Health has also confirmed this for their homebound patients. So the idea behind vaccine hesitancy is so broad as what Dr. Hoffman just said. People can have vaccine hesitancy or medication hesitancy or healthcare hesitancy for many reasons that are just ranging from geographic barriers and transportation to thinking, I'm not sick, I don't need it right now, or no one in my life has been affected immediately and I don't need it right now, to myths, to people just not wanting to be vaccinated in general. It's the job of the public health branch right now to parse out those small details, to figure out why aren't these areas near the incorporated areas where mass vaccines are being held, why aren't they as saturated with vaccine as other regions? Right now, the data is not strong enough for us to have an exact answer for that. And so I have a team of 3 people who are actively investigating this. And we're also going to use a method of trying to hit every single community in Humboldt County to offer them vaccine. And that's going to be a task that's going to be going on for months. Part of the schedule will also be an interest list for persons who are homebound in need of assistance. And then we will be following up with that.
Thank you, Lindsey. North Coast Journal, Thad Greenson.
Thank you, Mariah. I think first I just want to follow a quick follow-up question to what Ryan was asking. Lindsey, you mentioned that you have 3 people who are actively investigating this. Can you kind of give us some insight into what that investigation looks like, what some of the methods are at play there, and how you're trying to get that information?
Sure. First things first, we use 2 different kinds of data. We use what's called CARE data, which is the vaccine registry system of California. And that's supposed to be very active data as long as people are entering their data into CARE in California, which we're supposed to do as clinicians. And the other thing is what's an equity map that we are given, or a saturation map that we're given by both Blue Shield and the state, to show us what percentages of specific regions have been vaccinated, and we can hover over specific regions on this map and look at it. It can also break things down for us like age and sex, ethnicity, and first and second doses. So it gives us a little bit more data even. And we also break down how much every week right now we're giving in terms of allocations and how much distribution of each kind of vaccine going to different areas. So the 3 people who are on my task force with me are, I have 1 person who's actively working with facilities and persons who live in congregate settings, and then homebound persons, and she is coordinating with that population. Another person on the team is coordinating with fire departments, elementary schools, and farmers markets, and other places that we can go around the county with a mobile medical unit. And then my 3rd person is working on compliance and a scope of operations and training for the professionals who will be on this unit so that we can have consistency and good communication.
Fantastic, thank you. And then I guess kind of dovetailing on that, I'm wondering to what extent public health has worked with directly with care providers on kind of what strategies they should use to talk to patients and guide them through this very personal decision about whether the vaccination is right for them.
There are, oh, Mariah, would you like me to take that?
Yeah, go for it. And then if Dr. Hoffman or somebody else wants to add, that'd be great.
There are so many different methods of how we would help with care providers in their own offices, especially if they are giving vaccine and they are enrolled providers for the COVID-19 vaccine program. We encourage many times, especially in things like rural healthcare, that you have many frequent conversations with your patients about things that they may be hesitant about. And we have many resources on the CDC website, also on a lot of pediatric websites, because we deal with vaccine hesitancy very often in the pediatric setting. And this has to do with things like myth busting, but you can also just sit down and do listening sessions with your clients or your patients, like what Dr. Hoffman was saying, is that trying to meet them in the middle or trying to meet them where they are at about any concerns that they have about a vaccine.
Dr. Hoffman, would you like to add?
Sure. Yeah, I think there are a lot of good studies out there about vaccine hesitancy and how to work with families and patients who have concerns about vaccines. So Lindsey and her team have worked with all of the providers since the beginning, educating them on all things around this vaccine, from the handling and storage, the ordering of it, the how to make the clinics, how to run the clinics, and how to talk about it, the vaccine, with other healthcare providers. I mean, we had in the beginning, we were talking about vaccine hesitancy among healthcare providers and how to talk to your colleagues about it, because there were certain people even in healthcare who didn't want to get the vaccine or wanted to wait, because we were the first ones. And so I think there's a lot of information out there. We're working with everyone to try to get it out there. And there will be a point where it'll be obvious that the only folks left are the ones who either have great barriers to getting the vaccine, or they're some of the folks who just, don't want it at all. But I don't think we're anywhere close to that point right now.
Any more questions, Thad?
No, that's it for now. Thank you.
Great, thank you. Don't see, all right. So Nancy Garcia from El Leñador.
Yeah, hi. So I've been checking the county website, and I've seen that the percentage of Hispanics and Latinos who have been vaccinated is very low compared to other demographics. I think it was around 6 or 8% the last time I checked. So I wanted to ask, why do you think that there's such a disparity?
Dr. Hoffman, can you speak to that?
Yeah, it's something that we've noted across the whole state, and obviously there have been a lot of efforts to try to outreach to that community. I think again, this goes back to the same things we've been talking about. What are the barriers to getting vaccinated? There are logistical barriers. A lot of these folks are their work schedule doesn't fit with a mass vaccination clinic. So we've tried to the best of our ability, go to workplaces where we think the Latinx community is working. So we worked with a lot of, larger businesses that have a large proportion of Latinx workers and Spanish-speaking workers. We've made the clinics Spanish language friendly by making sure that there's appropriate forms in Spanish, that there are people there who speak Spanish in every station along the way, so that people feel comfortable and confident. My turn is also can be viewed in Spanish. So there's still work to be done. So the data that we have show that it's about a 10% difference between the Hispanic population and the white population in Humboldt County. And it's pretty close to what we see in a lot of other places across California. I did some outreach last week, met with a group called LatinoNet to talk about vaccination efforts and get the word out. And so hopefully, again, now that we have open eligibility to everyone 16 and over, we'll start to see more of those barriers break down, but it's going to take some time. And we're going to continue through the mobile outreach and other efforts in schools, going to schools that have a higher Latinx population, working with providers who are not yet authorized to be a COVID vaccine provider, but trying to get them enrolled so that in the next phase, when we open up to kids and younger groups, that we can bring some of these families in and get them vaccinated.
Thank you. And another question, are there going to be any more walk-in clinic days that you have scheduled already, like the ones this past Friday or Sunday?
Yes, Nancy, the schedule for walk-in hours was posted yesterday, and I can send you that news release following the news conference, just so you have the most recent schedule.
Okay, thank you, everyone.
Any other questions, Nancy?
No, thank you.
Okay, great, thank you. Taylor Elliott, Redwood News.
Hi there. So my question is, I know that last week you guys announced that there were 10 local, what we're calling breakthrough cases in people that are fully vaccinated. And so given that for Pfizer and Moderna, you have to wait 21 to 28 days in between doses, what about infections in between doses? Do we have any of those reported locally? I mean, is that common? Is that happening? What are the severity of symptoms for those infections?
Great question, Taylor. I don't have any data on that specifically for Humboldt County. It's not something that we track as much as the breakthrough cases, which would be someone who is at least 2 weeks or more out from the last dose of their vaccine. I do want to let everyone know, though, that those 10 cases that we know about were all asymptomatic or extremely mild cases. So no one was very sick in that group. It's not to say that someone can't get sick. I mean, the vaccine's not 100%, but it's very efficacious. And what we're seeing across the world is that these breakthrough cases are quite rare. They fit the same that we've seen here locally, which is that they're either asymptomatic or very mild, and that the data that was in the clinical trials, which supported that very few people got severe illness and no deaths in the clinical trials, really is supported with the data that's coming out with now millions and millions of people being vaccinated across the world. This is expected. We're going to see more cases like that. Anecdotally, as to your question, Taylor, I know of cases from other counties where people were partially vaccinated and know of some here. I just don't have data on the numbers, but there have been cases where people have gotten sick between the 2 doses and had more severe disease. So we want to get everyone those 2 doses, and we want to get them, don't think that if you have 1 dose that you're set. You really need that fully vaccinated status to be able to follow the rules of the fully vaccinated folks and loosen, your precautions that are now allowable by CDC and CDPH guidelines for fully vaccinated people.
And then I did have one follow-up question just kind of about that waiting period in between doses. So I know that people that got their first dose before the official transition to my turn, I know that they were kind of told that they would be, public health would reach out to them about scheduling their second dose. And I know I've personally gotten questions from people is if they're coming up on that date of the second dose and they haven't heard from public health yet, what should they be doing? And then I did have someone ask specifically, could they try to get a second dose at another location? Is that even a thing?
Yeah, so we encourage people to keep an eye out for the email if they're coming up. We have a large second dose clinic coming up, I think later this week. Is that right, Lindsey? And then, or
I think Friday.
For Friday, right? So people should have gotten that invite already. That went out earlier this week. But if you're within a week, like less than 7 days from the due date for your second dose, and you got it through one of the earlier public health clinics that was not through My Turn, and you haven't heard anything, then call the JIC 555. Sorry, 44. Oh my gosh.
441-5000.
Thank you. Sorry. 441-5000. And they can definitely help you out, because certainly some people's email, it gets stuck in the spam box or goes to the trash. And we want to make sure that all those people get an appointment. Do they have to get the appointment through public health? I think that if you have an opportunity to get it somewhere else, it's fine. But if it works for you and you get that email, you don't need to go searching out somewhere else.
Thank you. That's all the questions I have.
Thank you, Taylor. So we'll run back through the participants here. So Ryan Burns from LOCO, do you have any additional questions?
Sure, yeah. Dr. Hoffman, you said earlier that around 50% of the eligible population is at least partially vaccinated. But the county dashboard currently has it at about 35%. Of the total population. So if my math is right, that means that about 30% of the county is ineligible. Is that about right? And aside from being under age 16, what are the most common reasons for being considered ineligible?
That is the only thing right now that would keep you out of the eligibility is based on the age, because the eligibility is open to everyone. And I think the 16 and under population is around 27,000, I want to say. So yeah, that's where you're seeing that number. And that, Mariah, I think that gets updated today. So that's last week's numbers. And I'm quoting real-time data that we have, both from CARE report for this week, which will go up today, and then also reports from CDPH, which they are going to start posting as well on their website in the coming week or two. And I'll just one last thing. The statewide average for counties that CDPH is putting out is around 51-52%. So we're right there with the rest of the state.
Okay, you also said that 80% of the 65 plus has had at least one shot, and at the dashboard as it currently stands is still quite a bit lower than that. Is that just because it's last week's data?
Yeah, exactly.
Okay. And
okay,
thanks. I'm sorry, Dr. Hoffman's right. Ryan, we will update that this afternoon, and so we'll have the latest information visible today.
Great, thanks.
Thad Greenson, North Coast Journal.
Yeah, thanks, Mariah. So we've talked a fair amount today about getting vaccine being a personal decision, but there's obviously also a community component to it. The state goal of dropping all restrictions June 15th is contingent on vaccination efforts. Experts say we need to reach 75-80% to achieve herd immunity. I'm curious to hear from each of you kind of what you feel like is at stake for Humboldt County as a community in a community-wide vaccination effort and reaching that herd immunity level.
Dr. Hoffman, can you start us off?
Sure. We can put any number we want on herd immunity because the true answer is we just don't know. So for me, personally, as a physician in this community and a member of this community, I think that the goal is to get as many people vaccinated as possible. So there's no percentage that I would put on there that's going to magically get us to herd immunity. And so the vaccination effort is a community effort. It involves all of us. I think we're at the point now where we need to talk about it more. Again, moving from that scarcity mentality into that this is now available to everyone, and your turn is up for all of us. And utilizing our networks through businesses, through organizations, through family, churches, whatever your sphere is right now, you need to talk about vaccination and encourage people to go out and get vaccinated. And so we're doing that, campaign locally through the JIC. You'll start to see some of those ad campaigns coming out soon, sort of similar to the wear a mask campaign that has been going on throughout the whole pandemic around vaccination. And I think that everyone has a personal responsibility if they, want us to get there to, start to talk about vaccination and encourage folks to get vaccinated.
Scott?
Yes. So I think everyone has heard the phrase that the best remedy for the economy is a cure for the disease. There's something to be considered here in terms of how consumer confidence impacts local spending, local saving activity, and how the pandemic impacts consumer confidence. Consumer confidence, the first quarter of last year, right after the first shelter-in-place orders started going into effect, fell from 118 points to 86 points. That's the Consumer Confidence Index. And a lot of economists and agencies throughout the country view the Consumer Confidence Index as the #1 indicator of how our economy is doing. And that is why health and economics go hand in hand. So studies have already proven that as COVID cases grow, consumer confidence declines, and if consumers feel unsafe, then they're less likely to engage in economic activity, or at least less likely to engage in local physical economic activity, and they may over-participate in online economic activity, which is not necessarily always local. So from an economics perspective and for the business community, the more vaccines that we get out into the community, the more safe consumers will feel. And the safer they feel, the more likely that they are to spend money and spend it locally.
Thank you. Supervisor Bass?
I think I was thinking along the same lines as Scott in many ways, but I think people don't realize that there is a real danger that we could still go backwards. And now that people are excited and moving forward, kids are in school, all these different things are happening. We are not immune from going backwards. And, that's not good for employment. That's not good for families. That's not good for the tax base. I think a lot of it's connected to what Scott was saying. And I think there is a real danger. I know people that say, oh, we're good now. It's like, no, we're not. You can't say that at this point. And I also think it's important for government. I talked about reopening. Right now, government does not seem like we're open to people and to the public. And that is what we're here for. We have as open of meetings as we can possibly figure out how to do under the constraints, but it's not the same. We had a Measure Z conversation yesterday, and, everyone was basically saying, nobody was there. Nobody weighed in. Nobody watched. And, when something like that usually gets a lot of energy from community members happens, there's a problem. And so to me, that's part of the reopening completely. It's not just about the jobs and economy and families. Government is an important part. We may seem like we're a real, pain in the rear at times, but it is a place, and it's a place where we need the public to be. And right now, they're excluded. And I think we need to move forward on that so that we are open again to the public and lead the way. And that's basically my overall thoughts on it. I could probably think of a lot more because it really agitates me when people seem to just blow it off. So.
Thank you, Supervisor Bass. Ryan? Oh.
So my office looks at vaccination as kind of our transition to recovery. So the more people that get vaccinated, the more economic stimulus we're going to see, the more recreational activities are going to open up, the less restrictions we're going to have on gatherings and events. And to be frank, everyone's sick of this. Everyone's tired of dealing with the pandemic. And the best way to get through this and get over the pandemic is to get vaccinated. I know Dr. Hoffman's talked about going to Crabs games. If those are activities that you like to do, get vaccinated. And, we have, private events that are opening back up, but there's different restrictions for people who don't get vaccinated and those that do. And your life will become a lot more normal if you do go out and get that vaccination or both rounds of vaccination. And to Chair Bass's point, opening government back up, opening businesses back up, that's only possible through these mitigation tactics of getting vaccinated. So, for us, we're looking at ways to bolster our outreach and get those clinics full and get all of our allocations out. And it really is important. And I know there's hesitancy in the community or maybe a lack of access, but the more that we work through those challenges and get vaccine into arms, the more normal life will become. So I hope that addresses your question.
Thank you, Ryan. Lindsey?
Hi, thank you. I'm going to say a couple things about this. I think that in the question that came out about what is at stake, right? I think that stuck with me the most with the question. As a person who loves all people, but specifically cares for children, usually, I feel so strongly about the things that are at stake for our community members, like our children. We do not want to go backwards. We do have a mental health crisis. We have a housing crisis. We have many things that are competing with the pandemic right now that are not sustainable for many households and many community members, and everybody is feeling that heat. I know right now it is very hard to see the forest for the trees, right, for what this huge project is of getting vaccine out. But to tie it back in a little bit to how the allocation works is the big picture. The reason why they tell us to get vaccine out every week and empty our freezers is because we want to end this pandemic. We want children back in school next year. We want children playing sports. We don't want them to have to lose all of their friends. We want families to be able to do vacations together and see each other on holidays. And then that's how we're going to do it, is by emptying our freezers of vaccine every single week. And we're going to continue to do that, right? And that's kind of what I hear when I think of what's at stake.
Thank you, Lindsey. Nancy Garcia from El Leñador. Any additional questions?
No follow-up questions.
Great, thank you. And Taylor Elliott from Redwood News.
No, I'm okay.
Great. Well, we have just a few more minutes if anyone has any additional questions.
Sure, I'll ask another one. I'm just curious, with the 1,000 doses that were sent down to San Francisco, do you have any plans for, if you do take some vaccine out of the freezer and it winds up that you don't have enough arms to put them in, what are the plans for how to, what to do with that surplus?
Yeah. Go ahead, Ryan.
I can speak a little bit to that before handing it over. So we have a system through public health called MOOC, or it's Medical Health Operational Area Coordinator. And routinely we'll see requests through that MOOC system from other counties, either in our region or throughout the state, needing vaccine for a mass clinic that they have. So it worked out really well with 1,000 doses to San Francisco. Because on Thursday, San Francisco put out a regional request for 1,000 doses, and we had 1,000 doses to give. So that ensures region-wide, statewide, that those doses don't end up going to waste or getting thrown away. And locally, we do have kind of a call-down list of people who haven't been vaccinated, who can show up at a clinic or show up at public health to expend a few doses at the end of a clinic day. But for those larger trays or those 1,000 doses that we gave out, it's really kind of a regional or statewide effort to make sure that they are getting into arms and not being wasted.
So is it, can you say whether there have been any doses locally that have gone to waste, or have they all been put in arms?
Yeah, certainly throughout the, 4 going on 5 months that we've been vaccinating, there have been a few doses wasted here and there. In the first few months, it was 0 because the limited supply and the high demand. But as we get closer into what we're seeing now, which is clinics not filling, I think we will see, more wasted doses, and it's something that, again, has been seen in other places where the expectation had been all along that the clinics would fill, because that's what we had been seeing for months and months. So when they don't fill, it makes our job a lot harder, and you can have wasted doses. But we have protocols in place to prevent that. We have the call down list. We have the MOOC system. There is demand still in other places, and I think the demand here will hopefully continue to go up again once we get through some of the technological issues and get the word out about this change to an abundance mentality from the scarcity mentality. But yeah, very locally, very few doses have been wasted, and it's not been a problem. And now that we know what to expect with the clinics, hopefully we'll get them filled, and then we can bring the appropriate amount of vaccine to that clinic. And actually, that brings up another point of people showing up for their appointments. We are starting to see a larger no-show rate, and really want to encourage people to show up for that appointment so that we don't have wasted doses, because we need to make sure we have a vaccine for a person when they book that appointment. But then if they don't show up, there's a potential that vaccine could go to waste.
That's about all the time we have today. I can't thank you all enough for participating and joining us for today's news conference.